Hi there, it's Dr. Hart, and I am going to just do a quick review some slides on the nursing process. And this is my YouTube channel is Nursing with Hart, PhD. So let's get going into it. Okay, so what is the nursing process? It's part of our practice. Every patient that comes into the hospital or any unit, psych unit or hospital, will have a care plan. So that is, you may not do care plans in your clinical practice, you may or may not, depending on your the school you're attending, but it's important to know the parts of the care plan, and that's what I'm going to cover. Okay, so this is a way for us nurses to figure out what the clients, what issues they're having, what responses they're having to their disease process, whatever it is. Let's say, I like to use the example of diabetes, what physical problems they're having from their diabetes, or even psychosocial problems from the diabetes. Are they having foot pain? Are they having trouble with their diet? Do they need some patient education on their diet? Do they need education, lots of education on their medications, their insulin, metformin, whatever they're taking? They need education on how to do their injections for their insulin, how to monitor their glucose levels. And so the key to remember here is us nurses, we are not diagnosing the client. It's good to be able to figure out what it might be, but that's up to the doctor ultimately to take care of the medical diagnosis. Once you have a medical diagnosis, then us as nurses, we're going to write a care plan, and then we're going to follow that according to the nursing process. Okay, and we're going to document the client's response to those problems, such as diabetes. The first step of the nursing process is assessment, and I'll talk more about that. But what we are doing in the assessment process is we are gathering what is the patient's story as far as what's their physical story, what's their mental story, where do they work, what have they done for a living, what was their career, do they have family, children, adults that they're taking care of in the home. All of those things are going to be gathered. We're going to gather, and those sources are going to be lots of different sources. The preferred source is to get the information directly from the client, but sometimes we can if the client is not conscious or not able to share that information. We can get the information from the family. We will do a physical head-to-toe assessment, or you may do on your shift, you may do a focused assessment depending on what's needed at that time. You may get information from their medical records, and don't forget about HIPAA laws in not sharing confidential information on your client. I'm going to talk about subjective and objective data and the differences in those. So subjective data is based on a person's feeling. It's subjective. Based on the patient's feelings, it's their symptoms that they report, whether it's anxiety or nausea. It can't be measured or observed. Think of it that way. Nausea, pain, anxiety, things like that are considered subjective. And then objective are the things that can be measured and observed, vital signs, labs. They can be verified or measured. Okay? They are facts based on the test results or blood pressure, pulse. Those are all objective data that can be measured or observed. Okay? Okay, and so these slides have some questions in there in between that we can do. Which of the following is an example of objective data? And I just talked about that. Okay, so objective data, again, can be measured, verified, such as vital signs, labs that can be observed. Okay, so I'll give you a minute on this one, and we can come back and talk about it. Okay, so your choices are, we're looking for objective data. Your choices are A, pain, B, weight, C, dizziness, or D, nausea. Okay, so objective data is the key word in this question, and the answer is letter B, which is weight. The weight of a person is measurable. It can be observed on the scale. Okay, let's look at the other answer choices. Pain is subjective. Pain is what the patient reports to you. You can't see pain. It's not observable. Okay. Number C is dizziness. You can't see dizziness. The patient is just going to tell you, I feel dizzy. They may be moving around, but that's them moving around that you're seeing. You're not seeing the dizziness. Okay, and then nausea is also subjective. Okay, what would be objective would be the vomiting. You can see vomiting. Okay. Okay, now here's another one. Which of the following is an example of subjective data? Now we're looking for subjective. Okay, those feelings, opinions, self-reported symptoms that can't be measured or proven. Okay, this is what the patient says. Nausea, pain, anxiety. Okay, so I just gave you the answer. Which of the following is subjective data? Here are your answer choices. A is wound appearance. B, heart rate. C, temperature. D, anxiety. Okay, and the subjective data here is anxiety, something that can't be seen or measured. This is what your patient is going to tell you. They're going to tell you that I'm anxious. Let's look at the other choices. Wound appearance, the keyword appearance. You can see the wound. You can see if it's getting worse or better. And so that is definitely objective. B, heart rate is objective. You can measure that along with your vitals, right? Measure that. And C, temperature can be measured, obviously, with a thermometer. So that is also objective data, okay? Okay, now we're going to get into the 5 steps of the nursing process. And the acronym that you've heard of, you may have heard of, or you may not have by now if you're in first semester. The acronym is ADPIE, ADPIE, that is commonly used. A is for assessment. D is for nursing diagnosis. I like the way they clarify this here, because if you just see D is diagnosis, you might be thinking that you're supposed to come up with a medical diagnosis, and that is not what nurses do. Nurses come up with a nursing diagnosis that will tell you how they're responding to their symptoms or how they're responding to their medical diagnosis. P is planning, I is implementation, and E is evaluation. I'm going to go over each one of these. Okay, here's another question. What does the I in the acronym ADPIE represent? Okay, so I just gave it to you. This is C, implementation. The I is implementation. Don't get tricked on a question like this and think it's intervention. Okay, interventions are part of the implementation process. Okay, I see students get tricked on that one, where they see I and they think it's interventions. No, interventions are part of the actual step of implementation. Okay, and so these are the types of information that we gather. It's not just the physical self that we are assessing in the patient. We are also analyzing or assessing the psychological aspect of the patient, psychocultural, what cultural preferences do they have? What's their socioeconomic status? Are they working? Are they not working? Are they disabled? What is their housing situation? Okay, are they working? What is their, are they struggling with things like that, housing? And as a nurse, you should know, like in your local county, you should have some resources that you can give your client if they are struggling with something like housing. Okay, spiritual, what is their spiritual preferences? And what is their environment? When they go home at night, what is your environment like? For example, depending on their housing situation and what area they're living in, they may be living in a high crime area, they may be living in an upscale area. So their environment, they may be living with children, their parents, their grandparents, their grandchildren. There are a lot of different family variations nowadays. Okay, it's not just mother, father, child. Okay, some people are in the sandwich generation, it's called, where the person is not only taking care of their children, they're also taking care of their parents. So they're like in the middle of a sandwich. Okay, and their situation at home can greatly affect their responses to whatever disease process that they're dealing with, if they have a lot of stress especially. Okay, so the nursing assessment, okay, and these are the sources where you can get the information from. Your assessment information can come from which one of these sources do you think? A, physical assessment, B, family members, C, other clients, D, health history, or E, closed-ended questions. Okay, and I'll give you a minute on this one. We'll come back. Okay, and so we're trying to figure out what sources the nurse can get their assessment information from. Sources, okay. And the correct answers are A, physical assessment, B, family members, and D, health history, okay? So let's look at the other choices. C, we're not going to get information from other clients, okay? And E, we're not going to use closed-ended questions when I'll explain that. We're going to use open-ended questions. I talk about open-ended questions a lot when I discuss mental health, especially in therapeutic communication. Your questions should be open-ended. Let's discuss this, whatever it is. Tell me more. Tell me more about that. It's not going to be, did you take your medication today? That you can ask that, but you're not going to get as much information about what's going on with your patient. The preferred questions are open-ended questions in your nursing assessment. Okay, so the nursing diagnosis, you are gathering your assessment data. Then you're going to look for cues. I do case studies with the students. You're looking for cues in your assessment data. Cues on that may tell you that something's going on. Is the patient suffering from anxiety, depression, any other mental health disorders? Are they what physical problems are they having? So we're clustering that information. We're going to recognize the cues, and then we're going to analyze that and decide on how to best serve our client based on the problems that they're having. Okay, and we're always going to prioritize as nurses. And I've discussed before when I go over practice questions, when it's the same when you're prioritizing nursing diagnosis. You're using remembering your ABCs, airway, breathing, circulation. Remember, Maslow's hierarchy of needs starts with physiological, then it goes to safety, okay? Then it goes to psychosocial, then it goes to self-actualization, okay? Is at the top. So when you are coming up with a nursing diagnosis, you should follow these priorities, okay? We are doing coming up with outcomes, okay? And I use a very good nursing diagnosis handbook, okay? To help the students come up with goals and outcomes, same thing. And then you're going to come up with interventions. And interventions are always based on the evidence. Everything that you learn in your skills lab, whether it's bed baths, bed making, medication administration, everything is based on evidence. And we're using the most current evidence-based practice in everything that nurses do. Okay, and so we are prioritizing the nursing diagnosis. The goals or outcomes need to be SMART goals, and this is the acronym. S is for specific, M measurable, attainable, realistic, and timed. So they should be specific to the client. They should be measurable, attainable, so they should be realistic and attainable for the client. The client should be able to get to that goal or meet that goal. Realistic for them, and then timed. So, for example, if you're saying a goal, the client will walk from the bed to the door 40 feet from the bed to the door, measurable, realistic, attainable, by the end of the shift at 7 p.m. And that's timed. That's a specific time frame in there, okay? And make sure you include the client and the family when they're writing their goals. The client, if they're able to, they can help you write their goals. Okay, now we're on to interventions. Interventions, these are anything that you do when you walk in a patient's room, anything that you do for them, okay, are interventions. Raising the head of the bed, giving them a medication, anything, giving oxygen, any of those are interventions. Okay, they are based on your clinical judgment and your knowledge, and they are to help the clients with their outcomes or goals. They should also be evidence-based, used on current evidence to come up with the best practice for the best outcomes for your client. Okay, putting it all together. Okay, so when you write the care plan, you are coming up, doing your assessment, then you're coming up with a nursing diagnosis, and then you're doing the planning where you're coming up with outcomes and interventions, and then you're implementing where you're actually implementing the plan of care. In every step of the nursing process, you're going to document. Okay, you do your assessment, then you document the assessment data. When you do the nursing diagnosis, then you would document that, so on and so forth. When you do the planning, you're going to document what goals you have for the client and what goals and outcomes, what interventions you plan to do, and then evaluation. Implementation, you're going to document what you did for the client, and then evaluation, you're going to write how the client responded, were the interventions successful. Okay, step 4 is implementation that I talked about. That's where you're initiating the care plan and doing the actual interventions with your client. You're going to figure out whether or not the interventions were effective, okay? And then you're going to document interventions. Evaluation is the last step of the nursing process, and you can involve the client and the family. Sometimes the family is very involved for whatever reason. Say if the client for example, has dementia and they're not able to give you the information they need, then that's where we have to rely on the family a lot more. Look at those outcomes, make sure they're smart, and figure out if your client is meeting their goals. You may need to change the goals or outcomes. You may need to make changes to the care plan. And then again, document the plan of care and the outcomes. Okay, and that's it. That's just a quick overview of the nursing process. Hope you enjoyed it. If you enjoyed it, please like, share, and subscribe to my YouTube channel, Nursing with Hart, PhD. Have a great day. Thank you.